Anatomy Section 4, Lecture 16, Lower Extremities, Part 2. This slide shows the thigh movements: medial rotation, lateral rotation, extension, flexion, abduction, adduction. It also shows flexion and extension of the lower leg at the knee joint. This slide shows the surface anatomy of the thigh muscles along with the anatomical structures. You need to know the thigh muscles by compartment. The anterior compartment is the pectineus muscle, sartorius muscle, the quadriceps group, which is the rectus femoris muscle, vastus lateralis muscle, vastus intermedius muscle, and vastus medialis muscle. The iliopsoas muscle, which is also the psoas muscle and the iliac muscle combined. The thigh muscle medial compartment is the gracilis muscle, abductor brevis muscle, abductor longus muscle, abductor magnimus muscle, obturator externus muscle. The posterior compartment are called the hamstrings, which are the biceps femoris muscle, semitendinous muscle, and semimembranous muscle. The anterior compartment of the thigh, these muscles are known as flexor muscles of the hip and extensor muscles of the knee. They are pectineus muscle, iliopsoas muscle, sartorius muscle, and the quadriceps femoris group, which is the rectus femoris muscle, vastus lateralis muscle, vastus intermedius muscle, and vastus medialis muscle. The quadriceps tendon attached to the superior aspect of the patella. The iliopsoas muscle, which is made up of the psoas major muscle and the iliacus muscle, are located in the anterior compartment. The psoas major muscle, origin is lower spine, insertion is the femur, action flex the thigh, innervation is L1 through L3. Iliacus muscle, the origin is the iliac crest, iliac fossa, insertion is on the femur, action is to flex the thigh at the hip, innervation, femoral nerve, L2 through L3. The sartorius muscle is the longest muscle in the body. It's known as the talar muscle. Its origin is the ASIS, insertion, medial surface of the tibia, innervation is femoral nerve, L2, L3. Action is to flex, abduct, and laterally rotate the thigh at the hip. It also flexes the leg at the knee. The pectineus muscle, the origin is the pubis, insertion is the femur, action is adduct and flex the thigh. It also assists with medial rotation of thigh. Its innervation, femoral nerve, L2 and L3. The quadricep muscles are the rectus femoris muscle, vastus lateralis muscle, vastus medialis muscle, and vastus intermedius muscle. The action of the quadricep muscles as a group is to extend the leg at the knee. Innervation is femoral nerve, L2, L3, and its insertion of all of these muscles is into the tendon that attaches to the patella. Medial compartment of the thigh, the innervation is primarily the obturator nerve for these muscle groups. These muscles are the adductor longus muscle, adductor brevis muscle, adductor magnimus muscle, gracilis muscle, and obturator externus muscle. The gracilis muscle, its origin is the pubis, insertion, medial surface of the tibia, action, adduct the thigh, flex the hip, and medially rotate the leg. Innervation, obturator nerve, L2 and L3. Adductor longus muscle, Its innervation is the obturator nerve, L2 through L4. Adductor brevis muscle, its innervation, obturator nerve, L2 through L4. The adductor magnus muscle, it has two origins. The adductor portion is the pubis, the hamstring portion is the ischial tuberosity. It inserts on the femur. Its innervation, the adductor portion is the obturator nerve, the hamstring portion is the tibial nerve. Its action, adduct the thigh is the adductor portion, hamstring portion is to extend the thigh. The obturator externus muscle, its action is to laterally rotate the thigh. Innervation is obturator nerve L3 through L4. The femoral triangle, the borders are inguinal ligament on the superior aspect, sartorius muscle, lateral aspect, adductor longus muscle, medial aspect. The contents of the femoral triangle are called navel. It stands for femoral nerve, L2 through L4, femoral artery, femoral vein, deep inguinal lymph nodes, and that's from lateral to medial. The femoral sheath encloses the femoral vessels, but not the femoral nerve, so this creates a canal for passage of the femoral artery and femoral vein. The clinical significance of the femoral sheath is this is where femoral hernias can occur, and that's when the intestine comes through the femoral sheath. The important arteries are the external iliac artery, the femoral artery, the profundus femoris artery, and this gives way to the branches of the medial circumflex femoral artery, which supplies the femoral head and neck, and the lateral circumflex femoral artery, which supplies the lateral thigh. This is a closer view of the profunda femoris artery. It blood supply to the thigh. The branches that are important are the medial femoral circumflex artery, which supplies the femoral head and neck, lateral femoral circumflex artery, which supports the lateral thigh. The venous drainage from the lower extremity is the external iliac vein, which is supplied by the greater saphenous vein, which is significant for coronary bypass surgeries, and the femoral vein, which is contiguous with the popliteal vein and the small saphenous vein. The gluteal muscles can be divided into superficial and deep. The superficial are larger muscles, such as the gluteus maximus muscle, gluteus medius muscle, gluteus minimus muscle, and the tensor fascia lata muscle. The deep ones are smaller, and the main muscle here is the piriformis muscle. This slide shows the gluteus medius muscle, the gluteus maximus muscle, the gluteus minimus muscle, and the piriformis muscle. The gluteus maximus muscle, its action is to extend the thigh and lateral or external rotation of the thigh. It assists with raising from a seated position. Its innervation is L5 through S2. The gluteus medius muscle, its action is to abduct the thigh, medial rotate the thigh, and prevents the pelvis from tilting when walking. Innervation is L4 through S1. The gluteus minimus muscle, its action is to abduct the hip, medial rotate the thigh, and its innervation is L4 through S1. The tensor fascia lata muscle, its origin is the ASIS and the iliac crest. It inserts on the iliotibial tract, which attaches to the lateral condyle of the tibia. Its action is to flex the thigh. Its innervation is L4 through S1. Piriformis muscle, its action is lateral rotation of extended thigh, abducts flexed thigh, and its innervation is the sacral nerve S1 and S2. Obturator internus muscle, Its action is abduction, lateral rotation of the thigh. Its innervation is L5 through S1. The deep gluteal muscles are the superior glomerular muscle, inferior glomerular muscle, and quadratus femoris muscle. The hamstring muscles are the semitendinosus muscle, semimembranosus muscle, biceps femoris, which has a long head and a short head. Semitendinosus muscle. Its action: extend the thigh, flex the leg and rotate it immediately when the knee is flexed. Innervation is L5, S1, and S2. The semimembranous muscle, its action is to extend the thigh, flex the leg, and rotate it immediately when the knee is flexed. Innervation is L5, S1, S2. Biceps femoris muscle, origin is ischial tuberosity, inserts on the fibula, action, flex the leg and rotate it laterally when the knee is flexed. Innervation, L5, S1, and S2. Biceps femoris short head, its origin is the femur, it inserts on the fibula, its action is to flex the leg and rotate it laterally when the knee is flexed. Innervation, L5, S1, and S2. Sciatica nerve, L4 through S1. It's located inferior to the piriformis muscle, inferior lateral to the gluteus maximus muscle. It's divided into the tibial and common fibular nerve at the popliteal fossa. The sciatica nerve bifurcates into the common femoral nerve and the tibial nerve at the level of the popliteal fossa. This is located better on the posterior view than the anterior view. Popliteal fossa. The boundaries on the superior aspect is the biceps femoris muscle, the semimembranous muscle, and the semitendinosus muscle. The inferior aspect is the gastrocnemius muscle. The contents of the popliteal fossa are the small saphenous vein, the popliteal artery, popliteal vein, the sciatica bifurcating into the tibial nerve and into the fibular nerve, and lymph nodes, which are not pictured here. This is another view of the popliteal fossa with the popliteal artery, popliteal vein, the tibial nerve, and the common fibular nerve. The anterior compartment of the leg contains the dorsiflexors of the ankle joint and extensors of the toes. The four muscles: tibialis anterior muscle dorsiflexes the ankle and inverts the foot. Extensor digitorum longus muscle extends the lateral four digits and dorsiflexes the ankle. Extensor hallucis longus muscle extends the great toe. Fibularis terratus muscle dorsiflexes the ankle and everts the foot. This slide shows the movements of the foot and ankle: eversion, inversion, dorsiflexion, plantar flexion. This slide shows the nerves and arteries associated with the anterior compartment. The sciatic nerve becomes the common fibular nerve and the tibial nerve. The popliteal artery becomes the anterior tibial artery, which becomes the dorsalis pedis artery, which is inferior to the extensor retinaculum. Dorsalis pedis artery you will palpate in physical exam. This slide shows the muscles and tendons associated with the anterior compartment. Anterior compartment, tibialis anterior muscle. Its action: dorsiflex and invert the foot. Innervation, fibular nerve, L4, L5. The extensor digitorum longus muscle. Its action is to extend the toes and the ankles. Its innervation, fibular nerve, L4, L5. The extensor Hallucis longus muscle, its action, extend the great toe and dorsiflex the foot. Innervation, fibular nerve, L4, L5. Peroneus or fibularis tenaris muscle, its action, dorsiflex and evert the foot. Innervation, fibular nerve, L5, S1. The lateral compartment of the leg is also known as the everters. They are the fibularis longus muscle and fibularis brevis muscle. The nerve is the superficial fibular nerve. Injury to the lower limb can cause foot drop and loss of dorsiflexion of the ankle. The fibularis longus muscle, sometimes called the peroneus longus muscle, its insertion is the base of the first metatarsal. Its action, to evert the foot. Innervation, fibular nerve, L5, S1, and S2. Fibularis brevis muscle, sometimes called peroneus brevis muscle, its insertion is the base of the fifth metatarsal. Its action is to evert the foot. Its innervation is the fibular nerve, L5, S1, and S2. Posterior compartment of the leg, the superficial muscle group is the gastrocnemius muscle, the soleus muscle, and the plantaris muscle. The posterior compartment of the leg, the deep muscle group is the popliteal muscle, which flexes the knee, the flexor hallucis longus muscle, which flexes the great toe and plantar flexes the foot, flexor digitorum longus muscle flexes the lateral floor digits and plantar flexes the foot, tibialis posterior muscle, plantar flexes the foot and inverts the foot. The gastrocnemius muscle, its origin is the lateral condyle of the femur and the medial condyle of the femur. It inserts on the calcaneus via the Achilles tendon. The action is plantar flex the ankle to rise on the heel from the floor when walking, so walking on tippy toes. Its innervation is the tibial nerve, S1, S2. The Achilles tendon attaches the gastrocnemius muscle and the soleus muscle to the calcaneus. It's important to know this tendon because there's a lot of injuries to this. The soleus muscle, its action is to plantar flex the ankle. Its innervation is tibial nerve, S1 and S2. Its insertion is the calcaneus via the Achilles tendon. The plantaris muscle, its action is to assist the gastrocnemius and plantar flexion of the ankle, and its innervation is the tibial nerve, S1, S2. The tibialis posterior muscle, its action is to plantar flex the ankle and invert the foot. Innervation, tibial nerve, L4, L5. Popliteus muscle, its action is a weak flexor of the knee. Its innervation is the tibial nerve, L4, L5, and S1. The flexor hallucis longus muscle, this is your push-off muscle. This will be important when we'll talk about the push-off. When we talk about walking, you'll have the heel strike and then the push-off. Its action is to flex the great toe at all the joints and plantar flex the ankle. Innervation is tibial nerve, S2, S3. Flexor digitorum longus muscle, its action is to flex the lateral four digits, plantar flex the ankle. Its innervation is the tibial nerve, S2, S3. The plantar aponeurosa or fascia is located on the plantar aspect of the foot. There are several ligaments down here, and it's supported by the longitudinal arch. This gives you the plantar arch of the foot. Again, this slide shows several of the ligaments in the plantar aspect of the foot. The long plantar ligament maintains the longitudinal arch of the foot. This slide just shows several of the foot muscles from the plantar aspect. The foot muscles are divided into 4 layers. This slide just summarizes the 4 layers and their actions. The first layer of plantar muscles, they all attach to the calcaneus, and the main one to pay attention to is the abductor hallucis muscle, and its action is to abduct the first digit. This slide just shows the 3rd and 4th layer of the muscles in the foot from the plantar aspect. In the dorsum of the foot, you have the extensor digitorum brevis muscle. Its action is to extend digits 2, 3, and 4. Innervation perineal nerve. Extensor hallucis brevis muscle. Its action is to extend the first digit, the great toe. Its innervation perineal nerve. This slide shows the arteries in the foot. The only artery you'll be responsible for is the dorsalis pedis artery. The dorsalis pedis artery, the pulse can be palpated lateral to the extensor hallucis longus tendon. Joints of the foot that are important are the subtalar, sometimes called the talocalcaneus joint, and the transverse tarsal joint. They're responsible for inversion and eversion motions. The arches of the foot, it's important to look at the arches of the foot when you're inspecting the patients. The arch is relatively elastic, so it flattens during standing and resumes the structure when walking. Inversion of the ankle, the muscles responsible for this is the tibialis anterior muscle and the tibialis posterior muscle. This is where the majority of the sprains occur. Whenever a patient comes in and they said they tripped over a cord, you have to evaluate for the Jones fracture, which is a fracture of the proximal aspect of the 5th metatarsal. Eversion of the ankle, the muscles responsible for this is the peroneus longus muscle, peroneus brevis muscle. The fracture you need to be familiar with here is called the Potts fracture. Dislocation of the ankle, this is done during a forced eversion. What happens is the tearing of the medial ligament off the medial malleolus, and the result is usually a fibular fracture. This concludes Anatomy Section 4. This also concludes Anatomy Section 1, 2, 3, and 4.